Good afternoon. Thank you for joining us today for today's webinar, San Francisco Healthcare Security Ordinance. Please note the presentation slides will be emailed to all participants by tomorrow. At the bottom of today's screen, you'll see several widgets for you to use throughout the presentation. For example, if you have a question, please click the purple Q&A icon to the left. At the end of the session, we would love for you to complete our brief survey by using the teal feedback widget. You will also be able to download your SHRM and HRCI credits at the conclusion. Speaking today is Dan Kuperstein, Senior Vice President of Compliance at Corporate Synergies. Corporate Synergies is a national insurance and employee benefits brokerage and consultancy where Dan is a respected thought leader on healthcare reform. He has published many articles and videos on the Affordable Care Act and other laws and regulations which can be found in the Knowledge Center on corpsyn.com. At this time, I will turn it over to Dan. Thank you.
Great. Thanks, Missy, and welcome everyone to today's webinar on the San Francisco Healthcare Security Ordinance. And since that's such a long name for a statute, and since it's hard to say HCSO over and over again, I'm just going to simply refer to it today as the ordinance or the statute just to make things easier. So today we're going to have a little bit of fun with this topic, and it's definitely a topic that can get quite technical. It has been very confusing for our clients. So always definitely feel free to submit a question as we go along, and we're going to make sure we get to all of your questions as soon as we can. And if not now during the presentation, definitely by the end of the day today. So definitely send in those questions as we go through, particularly because we don't have a lot of time and it's just quite a technical topic. But the focus for today is really on two things primarily. One, we're going to look at understanding how the ordinance works, and then give you an overview of just the general requirements. And secondly, what changed in 2018 and how does that affect your health and welfare plans? And also along the way, we're going to provide you with some helpful takeaways and pointers that should hopefully make this process easier for you, and particularly if you're still trying to complete the calculation of your annual or 2018 expenditures for the enrolled population on your self-insured plan. So the big question I think that as I anticipated, I think from all the participants on the call or people who saw the notices come out about this webinar is, why are you doing this now? Dan, I mean, isn't 2018 almost over? Why are you doing a webinar at the end of 2018 for talking about how 2018 compliance is different? Right? Shouldn't you have been doing that at the beginning, at the end of 2017 when the new rules came out? And we did actually reach out to all of our clients, at the end of 2017 and began that process with them on this at the end of 2017. But it was one of those things where a lot of the rules just really hadn't come out yet. But also it's not too late. Even though we had to wait for clarifications on a number of different things from the Office of Labor Standards Enforcement, it's really still not too late to make sure that you're in compliance with the major component of this new rule, which is this first bullet here, which is that if you're a sponsor of a self-insured health plan and you're using the new averaging calculation that's explained in the new rules that came out at the end of 2017, then you still have until the end of February of 2019 to make additional expenditures to ensure that you're in compliance with the 2018 expenditure requirement for enrolled employees. And that's a major component of what you need to be doing. So you still have some time left there to get into compliance for a big part of the new rules. But the other reason we're doing it now is just because there's still a lot of employers out there that we speak with that are really not aware of how the ordinance changed in 2018, or even whether they're a covered employer. And the third main reason really is that it's just never too late to get into compliance, to avoid an audit by the agency that oversees this, the Office of Labor Standards Enforcement of San Francisco, which we'll just refer to as the OLSE. That's just something you just do not want to have to deal with. So it's always better to get into compliance late than never, and of course to avoid a creator deal, because if something like this is hanging on your books, and it could be a shadow over the due diligence process and prevent a buyer from wanting to kind of come in and buy the company. And so you really want to make sure that you've got everything cleaned up and you understand how things are different in 2018. And I mentioned this briefly before, but really when it comes down to another reason why we're doing this now is that it's just been a curvy road. The path to compliance has been really a very curvy road. The Lombard Street comes to mind, this is a picture of Lombard Street in San Francisco. From the time the rules were released in late 2017 until now, it just really hasn't been a straight and clear path to compliance. We started working with our clients as soon as the new rules came out, and we quickly realized that there was a lot of clarification that was needed in the rules on a lot of different things. There was a very general definition, for example, of what a uniform health plan is, but there wasn't much clarification as to how you calculate your expenditure requirement based on that definition. Also, there was no definition for what a participating employee is, which we found out later was the same thing as an enrolled employee. So there's a lot of things in the new terms that had to be clarified. And we, in our consulting department here at Corporate Synergies, had several calls and emails back and forth with the OLSE throughout 2018 to better understand what they wanted from our clients. And now we're in a much, much better place. But of course, it took some time to get there, and hence that's why we're doing this now and not at the end of 2017 and sharing all of this information with you now. So let's take a quick look at an overview of how the ordinance works and some of the key terms. First, we're just going to kind of give you a big general rule and explain, okay, here's sort of the big picture of how it kind of works. And then we're going to zoom in on the key terms to understand, because that's where it gets a little bit more technical and difficult to understand before we go into discussing kind of what changed. So let's start with the big picture, right? So the general rule here is that covered employers need to spend a minimum amount of money on healthcare and healthcare-related services called healthcare expenditures, or HCEs, on behalf of their covered employees, which are, generally speaking, those are employees working in the city of San Francisco. We'll give a more definite definition later. So they've got to spend a minimum amount of money on them, or pay that money to a fund established by the city of San Francisco that's referred to as the city option. That's a very general explanation. The city option is also sometimes referred to as Healthy San Francisco. And although this is, although that name is technically the name of one of the Department of Public Health's healthcare programs, so it's actually a little bit more complicated than that. So it's probably not 100% accurate to say the city option is the same thing as Healthy San Francisco, although we hear those names being used interchangeably all the time. If you want to be a little more specific about it, right, the San Francisco Department of Public Health actually administers two programs, which are both a part of what is called the Health Access Program. The Health Access Program is comprised of Healthy San Francisco and the city's Medical Reimbursement Account Program, which is essentially a program that holds accounts on behalf of covered employees, those people working in the city of San Francisco. So that's the more technical explanation, but that's generally speaking how it works. Now, covered employers can determine their required healthcare expenditures, right, that minimum amount that they have to pay on healthcare, by multiplying the total number of certain hours paid that are called hours payable, and we'll talk about that definition later, to each covered employee. There's a maximum of 172 hours per month per employee, and then they multiply that by the required expenditure rate that's applicable to the calendar year and the size of the employer. So for 2018, that applicable rate for large employers, which employers with 100 or more employees, that rate was $2.83 an hour in 2018, and it's going to be going up to $2.93 per hour in 2019. And so that's kind of the big picture of how it works. Now, I wanted to zoom in on some of the more specific terms here, because it's really kind of important to understand the key terms in a little more detail to really get a much better understanding of how this works. And when I was doing that, I kept on thinking of this phrase in my mind. Wow, it's really pretty amazing how many employers are subject to this law that you don't even really think about. And so when I was looking at these terms, the song "Long Arm of the Law," which happens to be a song by Kenny Rogers, kept coming up in my mind because this law really has an extraterritorial reach that's quite expansive. A covered employer doesn't even have to be located in San Francisco, the city or county of San Francisco, and so you could even just have one employee, one covered employee who could just be working at least 8 hours a week in the city, maybe driving a truck or a van through just a part of San Francisco for part of the day. And what you see here on this next slide is on the right is a map of a county map of the Bay Area. And as you can see, that the San Francisco is kind of like right there in that, kind of like where the bay goes out into the ocean. And it's a pretty small county. So, you could have people working in that, driving through there, going from, let's say, one of these other counties to another county and driving through. You could have one person there, driving through, and it adds up to 8 hours a week. And let's say you have 19 other people that are working in, I don't know, Florida or Chicago or, some other place around the country. And you don't have to be in order to be a covered employer, you don't have to have an office location there. So let's talk about that definition of covered employer. So generally speaking, the covered employer is an employer that is a for-profit business with 20 or more persons performing work. It could be the work does not have those 20 or more persons do not have to be performing work within the city or county, or a nonprofit business with 50 or more persons performing work per week during a quarter, and also employees, workers who perform within the geographic boundaries of the city and county of San Francisco, and is required to obtain a valid San Francisco business registration certificate pursuant to Article 12 of the Business and Tax Regulations Code. So that's the definition of covered employer. But as you can see, based on that definition, an employer doesn't have to be physically located within the city and the county, and for purposes of determining its size, all persons performing work for compensation in a given week must be counted regardless of whether they work in San Francisco. So as long as you have at least one person, a covered employee, one person working in the city of San Francisco, for 8 hours. And let's talk about what that is, right? Who is a covered employee? So a covered employee, with some exceptions that we'll talk about later, is an employee that is entitled to be paid. I'm sorry, I didn't mean to say covered. So they don't have to be covered under your health plan. But so a covered employee is an employee that is entitled to be paid the minimum wage, that has been employed by his or her employer for at least 90 calendar days, and who performs at least 8 hours of work per week within the geographic boundaries of San Francisco. And that includes both the county and the city of San Francisco, but it does not apply to the Bay Area. So if you have an office location in, let's say, Palo Alto, those workers working in Palo Alto would not be considered to be covered employees. So those are really some of the key definitions to understanding, why there's such a long arm of the law here. The next big rule here is the healthcare expenditures rule. Generally speaking, healthcare expenditures, or HCEs, refer to any amount paid by a covered employer to a covered employee for the purpose of providing healthcare or healthcare-related services. So this could be anything from a payment to a third party to provide healthcare services for a covered employee, such as for health, dental, or vision insurance. It could be expenditures made by a self-insured or self-funded insurance plan, payments made to a multi-employer health fund. So any kind of irrevocable contribution to a medical reimbursement account or health savings account. And that's a big part of this that should be noted, which is that in 2014, the OLSE amended the ordinance to require that contributions be irrevocable, which essentially is the same meaning as non-forfeitable that you may be familiar with under the HSA rules. So essentially, the employer can't get them back, if the employee did not use them. That was designed to ensure that the employees, would get the benefit of those health care dollars that the employer was spending. The next definition is hours payable, which these are hours which may or may not be hours actually worked. It includes both hours for which a person is paid wages for work performed within San Francisco and hours for which a person is entitled to be paid wages, including but not limited to paid vacation hours, paid holidays, paid parental leave, paid time off, and paid sick leave hours, but not exceeding 172 hours in a single month or 516 hours in a single quarter. So that's a very technical definition, but it's very important because that it's so integral to the calculation of what the employer spending requirement is. So let's also talk about what is the HCE rate, what is the expenditure rate or required healthcare expenditure rate, and what that is. So the applicable healthcare expenditure rate is the dollar amount, essentially that's the dollar amount per hour paid to a covered employee, and technically we should say dollar amount per hour payable, right, under this definition, to a covered employee that must be applied toward the covered employer's required healthcare expenditure requirement. So, we'll be referring to that throughout this as the required rate or the applicable expenditure rate, but that's a very key term that we'll be talking about. We should also mention, we talked a little bit about, we talked about the definition of covered employer earlier, as well as what the rate is, what the healthcare expenditure rate is for large employers, but we should also just briefly mention here as well that there's two other classifications of employer. You have the large employers are 100 or more employees. The medium-sized employers are businesses with between 20 to 99 employees, or nonprofits with between 50 and 99 employees. And for those, the applicable HCE rate is $1.89 per hour payable in 2018 and $1.95 per hour payable for 2019. So wanted to clarify that as well. The small organizations with less than businesses with less than 20 employees or nonprofits with less than 50 employees are exempt. So that's an important thing to understand. And then let's also talk a little bit about exempt employees, which is kind of going back. I know we're kind of going a little bit out of order here, but it's the second key term to mention because we talked about what a covered employer is, what a covered employee is, what expenditures are. But what about exempt employees? So this is actually the part of the process that takes a little bit more time when you're organizing and trying to calculate what your expenditure requirement is. So exempt employees, there's 5 main categories of exempt employees. Employees who voluntarily waive their right to have their employers make healthcare expenditures for their benefit. Now, this is a very specific requirement. There's actually a separate waiver form that is required to be completed by the employee voluntarily. And so just because you have an employee that's just waiving the coverage during your open enrollment process, that doesn't mean that they're actually really doing a voluntary waiver under these standards to be exempt. So it's important you understand that distinction. Employees who qualify as managers, supervisors, or confidential employees, and who earn more than the applicable salary exemption amount will also be exempt. So, I'm not going to go through all it, read line for line for you what those technical, definitions are for managerial, supervisory, or confidential employee. We're happy to send that to you after, but the definitions are what it sounds like, right? These are people who are going to probably be exempt workers, and they have to make over a certain exemption amount of salary. So for 2018, that amount was $97,722 annually, or $46.98 hourly. For 2019, the exemption threshold is for the salary component $100,796 or $48.46 an hour. So it's important to understand that. There's also 3 other categories of exempt workers: employees who are covered by Medicare or TRICARE. TRICARE is the health care program serving the uniformed service members, retirees, and their families. And in order to claim those exemptions, the employer has to actually document the employee's eligibility for those programs. The fourth exemption category is employees who are employed by a nonprofit corporation for up to 1 year as trainees in a bona fide training program consistent with federal law. And the 5th exemption is employees who receive health care benefits pursuant to the San Francisco Healthcare Accountability Ordinance, or HCAO. So that's kind of the big picture of the key terms. The other the last three are let's start with the employer spending requirement. That's just a general reference to the mandate of this law that we talked about earlier, and that general rule that we gave, right? So, that mandate that you spend a minimum amount of expenditures on your covered employees. The uniform plan requirement is a new definition that's part of the new rules about the averaging method, which requires that in order to be a uniform plan, the plan has to have the same benefit design for each enrolled covered employee, including the same copay requirements, out-of-pocket maximums, deductibles, coverage tiers, and eligibility criteria. Now, of course, you can break those out into the appropriate classes that you have, but that's the uniformity requirement. And then the participating employee requirement just means enrolled. So that was something that I think created some confusion for some of the clients that we spoke with in late 2017 and early 2018 was, what is a participating employee? And it just refers to an enrolled employee. So those are the key terms. Let's talk a little bit about how the rules were different prior to 2018. So if you had a fully insured plan, you would, with respect to the enrolled employees, the HCE requirement was calculated using the premium rates that the employer would pay for the medical, dental, and vision insurance premiums for the employee, spouse, and dependents. If that expenditure requirement was not met, the employer would have to supplement with another method, for example, a payment to the city option. For non-enrolled employees on fully insured plans, whether because they were ineligible for the coverage or otherwise, the expenditure requirement was calculated using the required or applicable expenditure rate times the hours payable, and those payments would then be made to the city option on a quarterly basis. So that's the general rule for fully insured plans. And then for self-insured plans prior to 2018, so all the way through 2017, enrolled employees, the expenditure requirement was calculated using the COBRA equivalent premium rates that the employer paid for the medical, dental, and vision insurance premiums for the employee, spouse, and dependents. If the HCE was not met, that required healthcare expenditure was not met, the employer was required to supplement with another method, for example, a payment to the city option. So what happened in 2018 and going forward was that the fully insured plan rules stayed exactly the same. So everything you're seeing on this slide, if you have a fully insured plan, remains the same. However, beginning in 2018 and going forward, beginning on January 1 of 2018, enrolled employees, the employer can offer a uniform self-insured or self-funded health plan to some or all of its employees, so long as it uses either one of these two methods for calculating their expenditure requirement. And so you now have to use one of these two new methods for determining, if you're going to comply. The first method is that the employer pays premiums or fees to a third party to administer the plan, like a third party administrator, and no portion of those premiums or fees can be returned to the employer, and the fees or premiums that are paid for a calendar quarter meet or exceed the required healthcare expenditure for each covered employee for that quarter. So this is an ongoing quarterly process, a per employee calculation, does not use any averaging. So it's very, very similar in many ways to the rules before, but a key component of this is that it has to be revocable. Irrevocable. So these are non-forfeitable contributions, and if you think about it, right, it's a little strange, right, because prior to 2018, right, it was very straightforward. There was a very clear system in place for how you did that. And then these amendments came out in 2014 that were applied to this, that saying irrevocable payments have to be made for self-insured health plans. And, it created a lot of problems and confusion for employers because it's like, why are we even having a self-insured health plan to begin with, right? Isn't a whole component, a big part of self-insuring is the fact that you build up reserves. You can, if the claims expenditure doesn't meet if it's lower than you expected, then you get the benefit of having to do what you want to a certain extent with those reserve funds. So, the benefit of self-insuring is that it's revocable, right? And now it's saying, okay, well, if you want to use this first method, it has to be irrevocable. So the first method is a little strange, and we don't really, none of our clients that we've worked with are using that first method. I am not familiar with any clients that have. It seems like every single client is using the second method. In the second method, the employer pays claims as they are incurred, and the preceding year's average hourly expenditures from that preceding year, they either meet or exceed the current year's applicable healthcare expenditure rate for that employer. This is what we generally refer to as the annual averaging method. And this is the new method that was allowed for 2018. And so both of these, you have to have what's called a uniform plan, which we talked about before, which means that you have to kind of offer everything on the same terms and conditions for each class of employee on the self-insured plan. But the annual averaging method is really very unique because it's very distinct from the process that had occurred before, right? Because before this, right, the way that the sort of the policy or the way that this whole mechanism worked was that it was designed to really benefit individual employees and put money into each of their accounts. And this is such a unique idea because if you think about it, right, you could comply with this, with the expenditure requirement, simply by having, one or two big claims from one or two of your participants in the prior calendar year. So that's, I think, something that's very unique about this, and it's kind of a little hard to understand is that annual averaging method. So how do you use this new annual averaging method? How does this new calculation work? Well, there are some preliminary requirements that you need to make sure you're doing before you can use it. First of all, the plan has to be a uniform health plan. And we talked about what that means, but it wasn't clear, at least initially when they released the rules, how do you actually go about complying with that? And the carriers, certainly not in 2017, but the carriers had no idea how to get this data about claims data in a uniform health plan. And the way it's supposed to work is that you're supposed to get the claims expenditures from your self-insured health plan, and figure out, okay, what is the amount that was being spent for each tier of coverage within that plan, each tier and each plan within the plan. So let's say you have a major medical plan that has two options. Let's say an HMO and a PPO. So you've got to figure out, within the HMO and within the PPO, and within each separate tier of each of those plans, how much is being spent on claims in order to comply with this uniformity requirement, and do that on an individualized basis for each of those classes of workers. So that was very complicated to get that data, and not expected to be as difficult as it initially seemed to be. So something to take a note of. Another thing, just to mention briefly about claims expenditures when you're using the annual averaging method. So since you're using these claims expenditures from the prior year to determine your current year's compliance, right? So if you're trying to determine 2018's compliance, you have to look back at your claims expenditures from 2017. But it's only certain claims that are included, right? If the claims, let's say, exceeded a certain limit that the stop-loss carrier set, and then the stop-loss carrier covered the cost of those claims above that stop-loss limit, then the amount of those claims above the stop-loss limit would be excluded from the claims expenditures that you could use as part of your healthcare expenditures for this annual averaging calculation. So it's something to take into account as well. Also, the plan's averaging method must include employees participating in the plan. So, what we learned means enrolled in the plan, and that can be either a group of workers that's only the covered employees, which, like we talked about before, those employees that are enrolled and working in the city of San Francisco, or it can be the group of all employees that are enrolled in the plan. So you can use either one of those classes of workers when you're putting this calculation together. Also, all of these participating employees must be receiving the same health coverage or product, which is what we talked about before with regard to that uniform health plan. That was something that was very confusing when the rules first came out as to how that would work. And so in other words, you have to be separating out by each tier within each plan offering within the plan to determine if your calculation method meets the expenditure requirement. And the employer pays claims as they are incurred, so you have to be essentially just self-insuring these claims. It can't be something that's almost entirely paid for by a carrier or other third party. Okay, so what are the benefits to the employer of using the new annual averaging method? I'd say by far the biggest benefit is that if you're using this method, the covered employer does not need to make quarterly expenditures to the city of San Francisco, except for the expenditures that are made on behalf of the non-enrolled or non-eligible covered employees. So with respect to those covered employees, that is, those people working in the city of San Francisco or the county of San Francisco that are either not eligible or they're just not enrolled, you still have to make the quarterly expenditures on their behalf. But for all of these people that are not in that category, that are covered employees, you don't have to worry about paying for them on a quarterly basis, and that makes this very attractive. The other big benefit here is that expenditures made on behalf of the non-enrolled or non-eligible. The other big benefit here is that something I mentioned before, which is this high claims year issue. The second component is really something really more part of the first bullet, which is that if you even if you have, let's say, non-enrolled or non-eligible individuals, if they fill out and sign that specific waiver form created by the OLSE, you still don't even have to deal with them on a quarterly basis. Now, as a practical reality, very few, from our experience at least, very few employees actually go through with that and sign that waiver form. So it's really not, it's not like you can kind of completely disregard the quarterly payments. There's, for at least for most large employers, there is going to be a pretty big group of people who are not enrolled or not eligible, and you're going to have to do that. The third bullet is if you have a high claims year in a prior calendar year, even if it's just from one or a few participants, that can allow the employer to satisfy its expenditure requirement in the current year. So let's say like last year in 2017, you had, even if let's say you had just one employee participant had twins that were preemies or something like that, then that might get you over what you need to spend for that year, even without having to look at what the other employee member participants did. So that's a really nice benefit that I think a lot of people don't really realize as well. So how does the calculation actually work? Well, this is where it gets a little technical, and when we're not going to kind of get into all the details and the hairiness of this whole process, because it's obviously something that can get a little complicated. But this is, I think, the general breakdown of how you would do it on this slide, and there are some other steps here and exceptions and things like that. But the big rule is that you determine what's called the average actual expenditure for the preceding year. And just to make, that's a long term, so we're just going to call that the AAEPY. And to calculate that AAEPY, you would look at the preceding year's total healthcare expenditures, which is, for these purposes, primarily claims incurred, although there's some other things that you can add to that number, such as payments to a third-party administrator. But generally speaking, that's going to be your claims incurred from the prior year, will be your HCEs for this purpose, and then you're going to look at that number for either one of the following two categories: either all employees enrolled in the self-insured medical plan, or the San Francisco covered employees that are enrolled in the plan. And then you're going to divide that number by the preceding year's hours payable to either all employees enrolled or, again, the San Francisco covered employees enrolled, and that gives you a number that is the AAEPY. And if the AAEPY either meets or exceeds the applicable hourly HCE rate for the current year, so in this case, if let's say you're a large employer, you're looking back at your 2017 claims expenditures to determine, what your AAEPY is. If let's say your AAEPY exceeds $2.83 or is the same as $2.83, then you're okay for the 2018 year with respect to your enrolled population. And that's the gist of how it works. That's the big part of that's how it really works. Now you still would have to make those quarterly expenditures for covered employees, that is, those people working in the city of San Francisco who are either not eligible for the plan or not enrolled in the plan. So that would be still your quarterly payment to the city. But all of those people that are enrolled would not have to be taken into account. So now the good news here is that if the AAEPY is less than the HCE rate for the current year, so let's just say you're a large employer in 2018 and it's less than $2.83, then you still have until the end of February of the subsequent year to make up the difference. So in this case, for 2018, you'd have until the end of February of 2019 to make up that amount. and that's a really nice benefit to have. Now, how would you make up that expenditure requirement or top it off, as you know, as we like to say? You would basically make the expenditure in some way available to the employee. So it could be, for example, an additional HSA contribution paid out to those employees, or something else that you would do to help employees pay for healthcare or healthcare-related services. So you may be asking, why is Mark Zuckerberg smiling? Why does Mark Zuckerberg have such a big smile on his face in this picture, this early picture of Mark on his laptop? And the reason he's so happy is because he just learned by using a very early version of Google Maps that he's not going to have to worry about the San Francisco Healthcare Security Ordinance if he decides to make his company Facebook headquartered in Menlo Park, California, which, although it is in the Bay Area, is technically in San Mateo County, which is nestled between the cities of Redwood City to the northwest and Palo Alto to the southeast. So he's just so happy that he just doesn't have to deal with this. Now, of course, I'm sure they have people working in the city of San Francisco today, but at the time I think he was like, this is a great idea, let's move the headquarters there. So that's just a joke, but I think that it illustrates the point that we get that question so often from our clients that have operations, particularly in Palo Alto, where there's just so many companies that have offices there. You know, if all of your employees that are working in the city of San Francisco are in Palo Alto, then yeah, you can have a big smile on your face and not have to worry about it. So that's great news. So let's talk about some additional employer requirements, as well as some key takeaways that you should kind of keep in mind as you go forward with this process. There are additional requirements to the ordinance that we didn't have time to discuss today, but you should definitely be aware of. One is the annual reporting requirement, which is a form called ARF. It's due every April 30th of every year, and it's pretty simple, not as complicated as your 1095Cs or 1094Cs, so not too difficult. The second requirement is the city option notice, which is pretty straightforward. It's essentially just a notice that to the employees, where an employer, if an employer chooses to make a payment to the city for the city option, it has to provide this notice to the employees, and it can be downloaded from the city option website at www.sfcityoption.org. So pretty straightforward. There's also ordinance record-keeping requirements as well. Generally speaking, you should always be keeping your, records of your HCE calculations, as well as if there have been any audits or anything like that. You want to just definitely have those in your HR, payroll, or benefits department available. There's other requirements as well. There's a poster requirement that you can also download from the OLSE's website. So those are some of the big requirements that we didn't have time to kind of go into a lot of detail today on. I think one of the big things, like where we see a lot of, there's two areas which I think are where we're seeing a lot of issues on. The first is that don't assume that your normal open enrollment waiver process is sufficient to meet the voluntary waiver standard. So we'll get sometimes these questions from clients that say, well, look, our employee waived coverage, so can't we just sort of exclude them completely from the process? And that's not how the OLSE sees it, right? They see it as, well, no, I mean, this person has to have voluntarily come forward, completed this form, and it has to be their specific form. So they take that voluntary waiver standard very strictly, and so that's an important thing to remember. The other thing is that if you're one of those employers that's going to be using the new annual averaging method for your self-insured health plan, you really want to determine your annual average expenditure requirement from the preceding year much earlier than you think. What we saw is even into middle 2018, a lot of the carriers out there had a lot of trouble putting the claims expenditures together and doing it in the way that the ordinance required. So it may take longer than you think for your carrier, but also even for your payroll department, because remember, you still have to look at the hours payable number as well and compare the hours payable number. You're dividing that into the AEPY, so it may take longer also for your payroll department to get the hours payable number together. So when you look at those two things, you really want to make sure you have enough time to do that and to complete that annual averaging calculation, because you have only until the end of February of 2019, for 2018. So you definitely want, if you haven't started that process, you definitely want to make sure you're doing that process now. So that's it for me today. I want to thank you so much for joining us this afternoon, or I should say this morning if you are joining us from the West Coast. And we really hope you found this presentation helpful. If you have any questions at all, definitely don't hesitate to reach out to us now or contact your Corporate Synergies account manager with any additional questions, and we're going to get back to you as soon as we can. Have a wonderful rest of the day. Thank you.